This is the first John Muir Health residency program of any kind, and what that means is introducing an educational mission for physicians in the midst of a high-functioning, high-performance healthcare system.
We want everyone to feel safe and welcome. We also made sure that it was light and that there was beauty and a lot of shared spaces.
We have affluence and we have vulnerable populations within 20 miles. We want to have a learner take care of a vice president of a tech company, and then maybe the maintenance worker from that company, and then maybe his grandmother. Back to back to back, in the same clinic, with the same resources.
My first week here, my preceptor, Dr. Nath, had me interviewing patients, had me forming my own assessment and plan and going over with them what that plan was and how's that going to work for the patient. So the amount of learning that you could get in just one clinical visit is huge.
We had scheduled feedback sessions throughout the rotation, and any sort of feedback that we gave or suggestions were really acted upon quickly. That was super impressive, and I haven't had that experience at any other rotation site.
Every single room, every shared space was intentionally designed with the learners in mind, and that's something unique. You know, very rarely do you get to start a residency practice from scratch and think of putting the learner and the patient at the center of it all.
The residents' training happens across the entire John Muir Health system. So the residents will be in the Concord Medical Center, seeing adult medical patients, working in the emergency room in the Concord Medical Center. They'll be delivering babies in Walnut Creek, working here in our family medicine residency practice, as well as many other primary care and specialty practices across the John Muir Health system.
We want our clerks to be able to go out and meet physicians in the community with whom they'll be working if they pursue a residency here. And we want them to have a sense of what a community-based hospital with resources and a mission to serve with compassion can deliver. Our goal is to create a team-based approach to the family medicine clinic itself, so that you will have the same attending, the same residents you work with, and the same medical assistant, the care of the patient as a team.
My opinion was truly listened to, and what my impression and what my physical findings were when I presented them, that was respected and it was incorporated into the plan. And as a student, to have that be a part of the treatment plan is huge, and it feels so great to go from your first 2 years of just being in books to actually being a part of the clinical care team.
Can you do that too? I'm gonna listen to my own heart.
The most important tool that we have as doctors with patients is our communication skills. Paying close attention to someone that may get teary-eyed, that may seem guarded. Those are the skills that we want our residents to feel very confident with.
After almost every patient, she would ask me to reflect on the experience with the patient. And even at the end of the day, we'd have a reflection session. It was valuable because I was able to ask my clinical and medical knowledge questions, but I was able to also think more broadly about the patient in context.
For so long you're working towards your dream of becoming a doctor, but to see it in practice, to see physicians being the type of physicians that I aspire to be, just made me feel confirmed, and this is what I was meant to do, is be a family physician.
Everyone in the call center, the receptionists, our MAs, everyone is a teacher, everyone is a leader. We're all here to make sure our patients and our learners get the best experience.
Dr. Catalina Triana came to us from the University of Texas. She brings a wealth of experience with behavioral health. We've been getting feedback from the medical students that she's the best teacher they've ever had. We also have Dr. Kishore Nath. In fact, he helped us establish a relationship with USC Medical School, and the students who've worked with him have been so excited that they've already told us they want to do clerkships with us and that they'd be delighted to be residents in our program.
What blew me away about my experience here at John Muir Health was how the staff treated you like family from day one, extremely welcoming, from orientation all the way through the 6 weeks. It was like they already knew me from the very first week, and then on top of that, as a student, to be truly incorporated into the clinical care team far surpassed my expectations of my role as a medical student, and the learning I got here was truly phenomenal.